Welcome to the Mindset Matters, the podcast where psychiatry, medicine, and real human experiences collide, all through the eyes of two psychiatric PAs.
We're your hosts, PA Mercedes Dodge and PA Jessica Spissinger, two passionate psych PAs on a mission to bridge the gap in mental health care.
So whether you're a provider just here to level up your psychiatric insight, increase your mental health skills, you're in the right place.
Each episode, we shine a light on the incredible work PAs are doing in psychiatry and beyond. Our goal is to build a community focused on better patient care, professional growth, and personal well-being.
This podcast, a little disclaimer, is for educational purposes only. We're not here offering medical advice, psychiatric advice. If you or someone you know needs support, please reach out to a licensed mental health professional. All right, guys, let's dive in. Thanks for joining us for mini mindset series with a PA Mindset Matters. You're here with Jessica Spissinger and myself, Mercedes Dodge. And today we're going to do a deep dive on lifestyle psychiatry. So, Jessica, what are the pillars of lifestyle psychiatry? What do you think they are?
So when I hear that term, I just think, well, must just be like all the obvious stuff when we talk about lifestyle changes. Part of the treatment plan is maybe meds, therapy, and lifestyle changes. So I'm like, okay, so lifestyle psychiatry are lifestyle changes, which usually includes sleep hygiene, diet, exercise. Sometimes I add in spirituality and social contacts and community.
Okay, so you pretty much got it. So I would say, so when we talk about lifestyle psychiatry, what we're talking about is making lifestyle the foundation in our mental health care. It's really about these evidence-based treatment models. We're going to dive into the evidence of these 6 pillars of lifestyle psychiatry. And you name them: physical activity, exercise, nutrition. And the third pillar is restorative sleep, and then stress management,
I did not mention that.
Toxic exposure. And I thought that's an interesting pillar, which we're going to dive into that. And the last one is connectedness, which you did mention, that social connection with people. And I think the more we are on our phones, on Instagram, connected with screens, we're missing that real life connection with people, that supportive relationship and community ties. So that's why I'm a big believer when I'm talking to family, kids, and teenagers is volunteer. Don't forget your community. Don't underestimate. That really helps our depression, anxiety, etc. Let me just take a step back because I'm big on terms. When we talk about
I think it helps to break them down.
So when we talk about lifestyle psychiatry, I think we gets a little bit muddy. Like, what does that really mean compared to other terms? It's not just wellness. It's evidence-based treatment models, which we're going to dive into the actual evidence on all of the 6 pillars today. But what mental health conditions are we talking about? When I'm talking about interventions with patients, I tell them, first, we got to know what we're treating. And then we need to know what the evidence towards the treatment for that condition. And so what we're treating with lifestyle psychiatry is actually depression, anxiety, PTSD, bipolar, schizophrenia, ADHD. So today we're going to actually go over the terms. So there's lifestyle medicine. So that's a parent discipline. It addresses diabetes, heart disease, obesity, and more. Let's zoom into nutritional psychiatry up on the top. It's often like the gateway concept for people. It's the idea that what we eat has a direct effect on how we feel. So the evidence there is very strong. So diet quality predicts depression risk, dietary interventions, reduce symptoms. And then the other term, integrative psychiatry, combines lifestyle and complementary approaches, yoga, acupuncture, supplements with conventional psychiatry. Then you have holistic psychiatry on the top right. So it's a more general term, sometimes less evidence-based, focusing on treating the whole person. And then you have nutritional medicine, talking about how medicine treats a lot of the mental health conditions, but not just mental health, talking about comorbidity, medical health conditions. So there's one that is not listed here, but I thought it was very interesting, metabolic psychiatry, and I did not mention it, but it's a new term.
That's fascinating.
Have you heard of it?
Yeah, I have. I've actually had a patient whose husband went on to see a metabolic psychiatrist, and I've had a patient who kind of self-experimented with some of the methods and had really great results.
Wow. Yeah. I mean, I was diving into this and I was like, wow, there's so much that's evolving. And I think that we needed to talk about all of it. There is some good evidence that each of these terms are trying to hit, but we need to come together. That's my approach. So the metabolic psychiatry is this new term often linked to the ketogenic diet and the mitochondrial health. And I think the mitochondrial health and understanding how mitochondria works in the body is really interesting. So basically, why now? Why now is lifestyle psychiatry so important? We face this huge rise in treatment-resistant depression, treatment-resistant X, Y, and Z. There's so much
Mhm.
psychiatric conditions that we hope this medication will help. And the science is actually catching up with us that it's not just pharmacological treatments, right? There's a lot of things that we put on the side that have great evidence in treating mental health. I feel like it's a change in expectation. Patients themselves are hungry for something more than just medication. I don't know if you've noticed that in your patient population.
Oh, yeah. I think it's refreshing and empowering when they realize there's much more to the picture than just a prescription, because people will take meds and only get so far and feel a little bit demoralized. Like they tried something and it worked a little bit, but they're not really at the proverbial finish line.
Yeah, and I think that when you have a patient that is interested in wanting more and doing more, that's the opportunity to have the conversation. I think what I've noticed is that we want to make those changes, but I've realized in my personal life that those changes, those 6 pillars, can be pretty tough, right?
Yeah.
We have a tendency to do things that are the least resistance. So fast food restaurants, a lot of takeout, just a lot of things that are automatic, which I think is unfortunate. Our history tells us we need to be connected with the earth, for example. And so when I do
Mm.
deep dives on interesting new topics, I always see these parallels and connections from the past. So what I wanted to convey in this slide is that science is catching up with what I think history already knew. So, as
Mhm.
far back as Hippocrates, health was seen as a balance. So, I mentioned a couple of these quotes. So, the ones I listed on the slide is digestion is the root of all evil, and then death sits in the bowels. And then he's also mentioned let food be the medicine and medicine be thy food. The treatment of disease was not in isolation, like cultivating lifestyle, cultivating diet, exercise, sleep. All the natural stuff around us is so critical for our physical health. I saw a parallel with the indigenous cultures across America. In indigenous cultures, health is about mind, body, spirit, and community and land. They're all woven together. I feel like lifestyle psychiatry is going back to the root, going back to the basics. And modern science is finally able to validate some of these wisdoms that we've had in the past. For me, it's very grounding for me as a person. Lifestyle psychiatry, in many ways, is kind of like a revival, a return to these principles. But now, what we're going to do today is we're going to actually dive into the neuroscience about it, the evidence.
All
All right,
right, let's do it.
let's do it. So, this is going to be a quick summary of some of the evidence. Let's talk about nutrition first. Food is medicine. Nutrition isn't just prevention anymore, it's about treatment. Across a lot of studies, what they've noticed is that higher diet quality tracks lower depression. So, what you eat impacts the symptoms, even if there's no weight loss. Think of Mediterranean style patterns, eating more plants, whole grains, legumes, fish, olive oil, and fewer ultra processed foods. It's safe, it's scalable, and it's really yummy. I was going to say basically diet quality. There's a bidirectional connection with depression risk, and a lot of random controlled trials have shown this. Diet can change depression, even if there is plus or minus weight loss. Let's dive into one study. This is called the SMILES trial. It's a 12-week randomized controlled study in adults. And these adults had major depression disorder. Most of them already was receiving some type of usual treatment. So participants met 7 times with a clinical dietitian. They were shifting toward the Mediterranean style pattern of eating that I mentioned. So more of that vegetables, fruit, legumes, whole grains, fish, olive oil, etc. So on the left of this figure, you can see a steep drop in what they call the MADRS score. Stands for Montgomery Asperger Depression Rating Scale, a clinician-rated measurement for depression severity. The scores fell far more in the diet group than in the social support control group. So that was the control group in this study. So it had a large effect size, about 1.16. On the right, look at remission. About one-third of patients in the diet group, 32% achieved full remission compared to only 8%. Big difference, right? Ultimately, the number to treat was roughly 4. So what that means is that for every 4 people who adopted a dietary plan, 1 extra person reached remission in depression. Well, I think one of the things that when you take from the study is like, wow, that's wonderful. What about adherence? How do I keep this going? The adherence in the study was pretty excellent. 90% completed all of those sessions with the dietitian, showing that even when people are struggling with depression, they can sustain meaningful change nutritionally. If we could target dietary support, it can significantly reduce depression and help with remission. So if we create a structure that is bite-sized, manageable, remember it was only a 12-week study, and you had a trusted dietitian who was able to educate and coach the Mediterranean style, it's excellent results. Do you have any thoughts about this study?
What was the total number of participants? That's always my number one question because it can make such a difference in how you view.
That's a great question. So on the bottom here of this slide, it says the baseline data with 67 participants. Out of those participants, only a few discontinued. It was a pretty good number. So basically at the end, it translates that these manageable, structured, connected dietitian visits really played a role in getting the depression in remission. So let's just jump into exercise, which is one of my favorites, actually, because I think I mentioned exercise is just one of my to-go things to help with my mood and my body physically and mentally. And so exercise isn't just good for your body. It's one of the most evidence-based supported interventions in psychiatry.
Movement is life, right?
Right. Movement is life. And I think we underestimate it a lot because we're so sedentary. Like most of my day, I'm sitting. And it's very easy just to order like takeout or groceries, things that make us not do exercise. It can be hard in the beginning, but once you start seeing how much it helps you physically, spiritually, emotionally, it's easy to keep on doing it. You have to be motivated and maybe have an accountability partner.
For me, the whole proverbial like the body in motion stays in motion, the body on the couch stays on the couch. I've had ups and downs like most people do throughout their life. I've gotten into really great habits and I've stuck with it. And then maybe something comes around where I'm derailed because life happens or I just hit a wall and get burnt out. I feel like many times in my life, I have to start that process again. What was a really good habit for me when it's always a little hard to start at the beginning. What always kind of keeps me going is just by starting like slowly working on the consistency, like it starts to become, it enters that self-reinforcing cycle. Once that's in, I'm good. I got my system, having worked on it since this summer. I was really needing to get back to that base. It really is the foundation that my day rests upon. I notice a difference if it's a day that it's not incorporated in some way.
Yeah, I completely agree.
I have a lot I can say about this.
Yeah, I know. And I think what I'm interested in is do each of these pillars a deep dive on itself. I feel like there's not just the evidence, which we're going over, but there's also how do we break our bad habits or build good habits? And I'm really big on looking at the psychology of it all.
Yeah,
And
because
so,
there's so much data that supports it, but like it's a tricky place to convey that, to live it. But then also like, how do you break through that should cycle where you've conveyed the information? I know I should do this because they should, because we all should.
yeah. Yeah. And that's why it goes back to motivational interviewing and having that trusted relationship. I wanted to talk about how exercise is not just good for the body. It's one of those most evidence-supported interventions in psychiatry, as I mentioned. There's multiple meta-analysis showing that physical activity has antidepressant, anxiolytic effects. So it improves cognitive function, reduces negative symptoms of schizophrenia, which I think is big. It even reduces the relapse rates of depression. So the most robust outcome comes from combining aerobic exercise and strength training. Importantly, these interventions are safe, accessible, and empowering to patients.
There's a huge difference to the mental psychological benefits from aerobic versus resistance training.
The big takeaway on this one, this was a 2024 in BMJ. It was a meta-analysis, and it looked at 218 randomized trials over 14,000 participants with depression. So the exercises was like walking, yoga, strength training, and it produced about double the improvement seen with antidepressants. And so they used something called the Hedges G value. And basically what is trying to say is that the more negative, the bigger benefit. If you look at this bottom left diagram with all of the types of exercises, and in the bottom, you'll see SSRI. You'll look at these exercise or these interventions, and then 0 is the middle. For improvement, you're looking for the most negative. So negative 0.5 to 0.6 is what you're seeing up here with like walking, jogging. And then if you go all the way down to SSRIs on the last row, it is a negative 0.26 for SSRIs. So people actually stuck better when they were doing the exercises. So there's fewer dropouts once they were engaged, and they got longer benefit. So they took this study and they did a follow-up study from Duke University, and they were looking at like, how did they do longer term, these individuals? They showed that only 8% of patients who recovered with exercise relapsed within 6 months, compared to 38% of those that used medication.
That's like wild.
Exercise doesn't just treat depression, it actually helps prevent it from coming back. I thought that was pretty awesome. I also broke down the types of exercise, like strength training was pretty up there. There was walking, yoga. And then there was some other studies that I didn't go into. Exercise, it helps with anxiety symptoms. There's a moderate effect size across thousands of trials for that. And then it also improves attention and impulse control in ADHD, especially in children. And so that's one of the things that I talk to families for ADHD treatment as I talk about, okay, here's the medications, but we also talk about other interventions, behavioral interventions. The more we exercise, it helps our attention. It helps our impulse control. It helps emotional regulation. I'm a big believer in exercise being part of the ADHD treatment, and evidence shows that.
Oh, yeah, definitely.
So it's a clear pattern here that movement improves mood, improves the mind, and all over emotional health.
But again, it's navigating those motivational interviewing skills so that you convey the information without it sounding preachy and sometimes shaming. I know we're going to talk about these elements as well, but just when it comes to food and diet, there's a lot of emotional expectations.
There is so much. And I think that as you do more clinical practice, especially in psychiatry, you learn to be humble as a clinician. You also learn that you need to ensure you create a safe space of talking about these topics and check in with your own implicit bias. So there is a lot of communication skills that we underestimate. One of the things that I think I've learned is that learning to dance with the patient. Where are they and where are they coming from? And what are their negative thought processes? So sleep, restorative sleep. Sleep is really important for our learning, attention, emotion, and our immunity. So poor sleep equates with the risk for depression, bipolar relapse, and suicide. And the gold standard, as we might all know, is CBTI, cognitive behavioral therapy, insomnia. It has strong, random, controlled trial evidence. And so sleep and mental health has a bidirectional relationship. Sleep isn't just rest. It's really like this maintenance for our body and our brain. It helps us learn. It helps us stay attentive. It helps us regulate emotions and helps our immune health. It helps with ADHD as it helps recuperate the ability for cognitive function. If we have less sleep, our amygdala is more heightened in reactivity. And I did a lecture on sleep at a couple of conferences. One of the things that really struck me on teenagers and adolescents is that the deprived teenagers had poor relationships. They had a lower threshold tolerance. So it really impacted their relationships. And you remember in the teenage years, that's what it's all about, is who am I friends with? Who am I going out with? Am I fitting in and belonging? So sleep really protecting both relationships, your mind, your body, and your emotions.
Yeah.
So
I feel like I've gotten so obsessed with my sleep now. I have to remind myself to sometimes live a little. You need to stay up and socialize, which we'll talk about in a bit too, right? Everything
yeah, we're going to talk.
moderation, including moderation.
I love that saying. Yeah, no, completely right. Like I love my sleep. And I think that when you find out more about yourself, what is my perfect amount of sleep that I need? So sleep, the study I wanted to review because there were so many studies. So this randomized controlled trial, what was looking at is looking at with kids who were struggling with sleep. So what they did was very simple. They only had 2 clinic visits and 1 follow-up phone call focusing on sleep hygiene. So they were talking about bedtime routines, consistent lights out, behavioral strategies for parents, but there was no medication. So I created this forest plot with the table from the study. Each dot represents the standardized mean difference, SMD. SMD of 0 would mean no difference. So as you're further left of 0, the greater the improvement in your sleep intervention group compared to the usual care. You can see several outcomes here. Sleep problems show the largest shift to the left, meaning major improvement. Symptoms, particularly inattention, also improved moderately. The quality of life scores, that's how families and children rated their daily function and well-being, moved significantly. So the number needed to treat was about 4. That means for every 4 children who got the brief sleep intervention, 1 child no longer had moderate to severe sleep problems by 3 months.
Wow.
So better sleep, fewer ADHD symptoms, and happier kids, and happier parents.
Sure.
There was
We
so
all know
many,
that's true.
there were so many great studies, and I just thought this was interesting because I was looking for one that was not using medication as a control. I have a lot of parents and patients that ask for sleep medication, and one of the things that I talk about is your brain is developing a lot, right? We have the melatonin coming naturally with our pineal gland. So if we put on sleep medication, it's a band-aid and it actually disrupts sleep further because our body is trying to figure out sleep. And nowadays we have so much of the pressure of stay up on your video game, stay up, or social media scrolling. And so we have to put in armor to fight all of these gravity pulls.
I have teens and they're juggling a lot of workload on
Oh, that's a
top
good
of
point.
their extracurricular activities, on top of all of this socializing in between. The amount of work they have is really no less than what we had in high school, which is a lot. My kids will burn the candle at both ends because they have to get up really early to get to school on time. And it's a constant kind of battle of being like, okay, you're daytime, you're done with school. Now are the hours to maximize your workload, but they're tired from their day. They want a little bit of that free time. But the next thing you know, it's flipping into staying up till 1 or 2 in the morning some nights.
So it
So
impacts their attention, it impacts their motivation. There's a lot of pressures that are different compared to 2 or 3 decades ago. That pressure academically is true. And I think that as parents and clinicians, we need to help advocate for healthy boundaries and help our kids advocate for healthy boundaries.
like the sleep cycles change in teens, where
Mhm.
teens
Mhm.
consolidating sleep really does blend into those longer times where they stay up later, but then they need that extra sleep
Mhm.
longer.
That's one of the things I talked about in my sleep talk is basically you're having these changes in the brain and the changes are felt where your teenagers don't want to fall asleep until 2 or 3 hours after the adults are going to sleep, right? And so then that means they're waking up sleep deprived already because their body's a different clock. And then it'll change again, and then when we get older, it'll change again. But yeah, there's so much involved in keeping our kids healthy. So the next topic is stress management and calming the system. So there's a lot of random control trials on mindfulness, yoga, meditation. All of them improved anxiety relapse. This is a very interesting topic because when we talk about stress, there's natural stress, acute stress, chronic stress, and then stress over time causes inflammation and affects so many parts of the brain. And so it'll affect the sympathetic system. It'll impact the HPA axis, causing this inflammation. And one of the things that I was doing some dive into impacts the gut. So it's like this perfect storm of anxiety, low mood, gut issues. And so what the mind body practices that we're going to go into, it actually reduces those symptoms and lowers the cortisol, damps the stress reactivity. So ultimately, what I came out is that it down regulates the natural stress biology, and then it actually up regulates the recovery process. So let's dive into the study I chose. This table summarizes findings from one of the most cited review in lifestyle psychiatry. It was by Goyle, 2014. It was a meta-analysis in the JAMA Internal Medicine. It examined 47 randomized clinical trials involving over 3,500 participants who engaged in various meditation programs. And so I created a key on the left of what are the programs. We have MBSR, which is a mindfulness-based stress reduction, and that was 8 weeks. They combined mindfulness meditation, yoga, and awareness practice. Then you have MBCT, that is mindfulness-based cognitive therapy, which integrates mindfulness with cognitive behavioral therapy tools to prevent depression. Then we have CSM, concentration or mantra meditation, where the individual focuses attention on a single sound, phrase, or object to train attention and calm the mind. So what you're looking at here on this big table is another forest plot, which visualizes the effect size across all the trials. Each horizontal line represents one study, and the diamond is the pooled estimate showing the overall effects. So the x-axis shows the standardized mean difference. So 0 would mean no difference between groups. A negative SMD means the meditation group did better. So lower anxiety, stress, or depression scores compared to the control. In this analysis, I'll just summarize it. So MBSR and the MBCT produced moderate reduction in anxiety and depression, about 0.3 to 0.4 of the SMD, which is similar to what we see on the first line with psychotherapy or lifestyle interventions like exercise. Importantly, these programs, like I mentioned, were safe, acceptable, and it had actually sustained benefit after months after completion. But the takeaway here is mindfulness isn't about just relaxation alone. It's an evidence-based tool that really helps the stress system. This was a really good study, but ultimately it just proved that the mindfulness and meditation, it has really great moderate reduction of depression and anxiety. And so I'm a big believer in meditation and mindfulness, but we can't just throw it onto the patients like, okay, here, do this, right? You don't want to give them just like a script. You want to figure out maybe what they already do in their mindfulness practice. Like sometimes people will go drink a cup of coffee outside and they don't realize that itself is mindfulness practice, right? Pausing and connecting. And so the word meditation can be overwhelming. People think that you have to be this yogi and flexible person to not be able to think anything at all. And that is so incorrect. And so I think that understanding what mindfulness is and how meditation plays, it can really shift people's perspective and realize, oh, I do a little bit of this mindfulness ever so often. How can I expand it?
Yeah, one example I make sometimes too, which is kind of funny, is how like now that people like don't really smoke cigarettes as much, like some people certainly do, but for people who smoked, they would have smoke breaks in the middle of their day. They'd go outside, they'd smoke a cigarette, they'd get that chance to regulate a little nicotine, as well as the breathing. Even though we know it's like carcinogenic breathing at the time, it was still deep breathing. And then people quit smoking, which is great, but then they don't take those like breaks. And we kind of all need to go back to taking smoke breaks, just minus this.
Yeah. You're completely right. And I think that there's that social expectation. I think we need to chip away on that for us to do mindfulness breaks or meditation breaks. So you'll see some workforces recognizing that they need to provide more breathing room, right? And not just go, go, go in your work life. All right. So connectedness, social connectedness. We're talking about relationships, purpose, nature, and spirituality. So loneliness, we probably all know here that it's a mortality risk, right? Actually, loneliness has the mortality risk equivalent to smoking 15 cigarettes a day.
Yeah, I've been hearing that a lot lately. That's definitely like a message that's really getting reverberated. I think it's really resonating with people that we need to wake up and pay attention to this.
I agree. I think the human connection is underestimated. So There's meta-analysis. We're going to go over one, how strong social ties predict better survival and lower depression and anxiety, while loneliness raises the risk. So even in the face of adversity, like first childhood experiences, having one trusted adult dramatically improves the outcomes. Because if you have 4+ ACEs, adverse childhood experiences, you're increased risk for both mental and medical health conditions, including cardiovascular, cancer, depression, and substance use. But having that one trusted adult pushes on how belonging and connectedness, feeling protected and safe, impacts our ability to recover in our life. So let's just jump into the study. This is a loneliness meta-analysis. The quick take here is across solid longitudinal studies, loneliness ticked up during the pandemic. The pooled estimate here is on the bottom row. That's the diamond showing higher odds of feeling lonely during COVID versus before. Each line in this study, the square shows its results, and the horizontal bar is, there it is, 95% CI, which is a confidence interval. The bigger squares are the heavier weight in the analysis. The vertical dashed line shows no difference. The diamond at the bottom, as I mentioned, is the pooled result from all the studies using what they use a random effect model. The pooled here, OR, this big diamond, was 0.33. So that's a small increase in the odds of loneliness during the pandemic compared to the pre-pandemic. So what does this translate like at the end of this? On average, it says that people were a bit more likely to feel lonely during COVID, especially for those already at risk, those that were already living alone, health conditions, lower support. Loneliness isn't just a feeling. It's linked to earlier death and more depression and anxiety. The practical takeaways are screen for loneliness, normalize, and connect. So brief check-ins, concrete connection is itself its own prescription and will move outcomes. So measure of loneliness is important that we catch that in our patient population, talking about their activities, who are their best friends, who are their friends for my patient population, kids. So let's go to, I think this is the last one, which is basically substance use. So we're going to talk about alcohol, cannabis, and nicotine. They actually impact the brain and how the brain functions. In lifestyle psychiatry, it emphasizes harm reduction and replacement with pro-health habits. We already hear a lot about alcohol, tobacco, and how it just blunts distress, but that's short term. At the end, it worsens mood, it worsens anxiety over time. And so when people quit smoking, there was a meta-analysis that showed meaningful improvement in anxiety and depression within months. Another interesting part with the lifestyle psychiatry guidelines is they talked about not just substances, but they talked about air pollution. So how air pollution is linked to higher depression risk and saps energy from individuals, and it prevents individuals to engage healthy outdoor activities. Takeaway here is you treat the stress, remove the harm, and build coping skills. In this study, which will be our last study, we often hear that nicotine calms the nerves or that a drink helps take the edge off. But the evidence shows a different story. Self-medicating with tobacco or alcohol will dull the distress in that moment, but it worsens over time. This BMJ meta-analysis in 2014 from Taylor found that people who quit smoking actually felt better. Anxiety dropped from about 0.37 standard deviation, depression by 0.25, and stress by 0.27. So with clear gains in positive mood and quality of life. So those who quit had lower depression anxiety scores at 6 months compared to those that who continued. So there's just a lot of studies on this. I just don't think a lot of us talk about it. And I think it goes back to the point about we know we need to tell patients to quit smoking or drinking, but how do we go about helping them do that? It really is difficult, but it's not impossible.
That probably is a conversation to be continued.
I think motivational interviewing is one of the things that really changed the way that I practice. And so I hope that people are interested to build that skill set. So in summary, today, I wanted you guys to see that lifestyle psychiatry represents a shift towards the whole person-centered in mental health, emphasizing how we can live day to day by making these changes in those 6 pillars. And I think there's a lot that we can dive into, and people are going to hopefully get excited about the research and excited about what lifestyle psychiatry is about. I think a lot of us can start integrating that in our clinical work But we need those tool sets, like you said, like motivational interviewing. How do we make SMART goals, which SMART stands for specific, measurable, achievable, relevant, and time bound, and just building that collaboration with patients. I hope people thought it was a good glimpse of what lifestyle psychiatry is. And we'd love to hear what other topics you want to learn about or want to hear about, because obviously Jessica and I love doing deep dives. Thank you so much for having us, and I hope you follow us on our channels.
Thanks. It was great.